Welcome everyone to such a joy, such a pleasure. Today I have Joanne Twombly with me, and I'm so honored. She is a psychotherapist and she works both with IFS and EMDR, and she is the author of the book that we'll be speaking about today, Trauma and Dissociation Informed Internal Family Systems: How to Successfully Treat Complex PTSD and Dissociative Disorders. And IFS and EMDR is something that, at least IFS, we've spoken about several times here on the podcast. So this is going to be more of an addition to what you already may know, because Joanne has a certain take on it and a certain critique, perhaps, to the popularized IFS approach. So I'm really looking forward to hearing that and diving more into the book. Welcome, Joanne. I'm so happy you're here.
Yeah, thank you so much for having me.
You're most welcome. You're a dedicated Virgo person. So you've done the groundwork. Yeah, you've done the groundwork. And yeah, I'm just happy to hear whatever you want to share. Um, from the book, of course, I've gone deep into thinking, reflecting about dissociative states and finding myself in it a lot. So actually, I feel like asking you that in the beginning, how do we discern? Because there's a range here around dissociation. So maybe you can answer like what dissociation is and when it becomes really problematic.
Okay. So what I would say is, first, I'm going to say I love IFS. And the reason why I wrote this book is because I was getting referrals from really senior IFS people, not just referrals from them, but referrals from people they had worked with saying they had fallen apart in standard IFS treatment. And coming to me because I have a specialty in working with people with complex trauma and dissociative disorders. And basically, I think if standard IFS is done by really good IFS clinicians, is either leading to people being stalling out and not making progress, or leading to them getting worse, then something needs to be added. And it's fairly typical. I mean, I think that's often what's missing in therapy is knowledge of how to work with people with complex trauma disorders and dissociative disorders. So, I mean, IFS is a kind of ego state therapy, and they have added the concept of self, which of course is there in some other therapies too, in different ways. It's not completely unique, but I think that the way IFS is put together is just so useful, and I like the language. I think it's really super helpful. So, but dissociation basically is, I mean, obviously IFS says we all have parts, but mostly if people are going through really difficult childhoods, there are often times when things are just too painful and people need to disconnect from it. So a part of me is being raped at night, a part of me goes to kindergarten.
Yeah.
If the part of a person who's being raped at night goes to kindergarten, they'd be completely overwhelmed and not functioning. And so it's just simply a way of managing a situation that's not manageable for in a normal way. And I'm going to say normal in quotes. And what I say to people is basically developing a dissociative disorder is a normal result of an abnormal situation. It's not normal to be abused so much when you're a kid, or severely neglected, abandoned, parented by someone with really complex attachment disorders. And I think that's the best way of thinking about it, that it's a normal way to cope with an abnormal situation.
Love that. Yeah.
And IFS says we're all multiples. I think there are a lot of people who have dissociative disorders, which used to be called multiple personality disorder, take exception to that being co-opted. But I think it makes sense. We all have parts. And, there's the part of me that likes chatting with people and doing podcasts, and the part of me that gets anxious about it. And we all have different parts. So it's a really great way of working with people.
Yeah.
And it's a matter of degree. I mean,
Right.
we all dissociate to some extent. Like when I tie my shoes, I don't think about how I'm doing it. I only think about how I'm doing it when I'm teaching some kid how to tie their shoes. When I do it, I just go blip. Now, where is that information? It's basically dissociated. It's someplace in my brain, but I don't need it clogging up my brain. I can just put it aside. So that would be an example of normal dissociation. And I think IFS works so well with most people because many people don't have that kind of separation among parts. They have a much more gentle separation. So like, for instance, I can play hair monster with the kids across the street, but if I need to take a professional call or do something adult, I transition smoothly. I don't get stuck in that hair monster playing kid part of me. I can just transition smoothly. I don't lose the connection with that. I don't lose the memory that I was there. Somebody with a dissociative disorder might get stuck in that child part and not be able to transition so smoothly. So I don't know. Does that make sense?
Right. Yeah, absolutely. Yeah, that's what I've heard, that you can think of it like if it's really problematic, then you forget. You don't remember what the other part has done. But
And it's not like you totally forget because that information is there. Of course, I mean, most of the time, unless it was, there are people who forget because they were drugged and don't have the conscious information, or they were hurt, or something happened before they learned how to talk, which is when we form regular memories. So sometimes that information isn't actually present, but for the most part, it's there. It's just stored differently.
Right. It's just blocked out somehow.
Yeah, and you have to access the part that's holding it. In IFS language, it would be you have to access the part with the burden to be able to get that information.
Yeah. Well, I did come to work and say to my colleagues that now I do think I have a disorder, a personality disorder, just one of them, but multiple personality disorder at least. From reading it, because there was so much I could recognize. But as you're saying, it's a common thing, and for those of us with complex trauma or complex PTSDs, will be more prone to those symptoms.
Yeah, and actually PTSD is also a dissociative disorder because the hallmarks of PTSD are numbing and intrusion, and you can't have numbing without being dissociated, right? It's tucked away when you're numbed out.
Right.
So, and there's a huge range. I mean, like another example is people who work in ambulances or fire departments. I mean, you can't go to an accident where there's an badly injured child and function if you haven't tucked your feelings away. So you kind of have to dissociate to be able to function if you're in one of those jobs.
Yeah.
Otherwise, you're going to be distracted by feeling horrified or sad or whatever.
That's a good example. So it points to that it is an ability as well that we can use. And so
It's totally an ability.
yeah.
Yeah, that's a good way of putting it. It's not, I've done consultations where people say she's doing better, she's dissociating less. And I'm like, no. You want people to dissociate better.
Yes, I love that. Dissociate better. Dissociate better. So how do we dissociate better? What do we mean by that?
Well, it's sort of, I mean, I don't quite understand why IFS says that. IFS basically doesn't teach people coping skills because, and the reason why, if I'm getting this right, is because they say we have everything inside of us that we need. And what I would say it a little differently, is we have what we need inside to learn how to do coping skills.
Oh.
And maybe ultimately anybody can get there, but if you grow up with parents who are pretty dysfunctional, have their own trauma histories, solve their problems by beating the crap out of you or drinking or going to bed, then probably they're not going to teach you healthy ways of coping with feelings.
No.
So what I think is really important, and is also the standard of care for people with complex trauma disorders, and I'd say basically any trauma disorder, is learning coping skills so you can manage the affects that that are related to the whatever traumatic material you went through. Meaning, one of the things I learned early on in hypnosis training was that when people with a trauma history relax, it relaxes their surface defenses, and then they get intrusive thoughts and feelings. I used to get a lot of referrals of people who had flunked out of a stress management with meditation program, because they'd start meditating, it would relax their surface defenses, and then they'd get these massive intrusions. I mean, and some people can manage. Some people, I had a client with a big meditation practice, and what we figured out was she meditated to here, had a lid here, and under this was all the trauma. So she made it work for her, but I've treated a lot of people who've fallen apart trying to meditate or trying to do diaphragmatic breathing or guided imagery. So I start out by teaching an exercise called safe space imagery, which teaches people to block out intrusive thoughts and feelings. And that part of my book you probably got to.
I did read that.
Yeah, and containers, and containers are just, well, I said I like people to dissociate better. So, I often will identify, well, how are people keeping things contained? Like, do you have flashbacks 100% of the time? Or is there a time of day when you're at work, you don't have flashbacks? Okay, well, then you have them under an unconscious lid. Or maybe you're missing some memories, or you lose time. So where is that? It's under an unconscious lid. So let's just evolve that lid into a container that you can have conscious control over, and is a different way of holding it that is mostly gives you more choices and more control. So that's an example of how I like people to dissociate better.
Wonderful, wonderful. And in there, you're also saying in a lot of treatments, and I think this is a very fortunate thing that in a lot of treatments, it involves some kind of meditation or grounding. I think it's very fortunate that we have that. But then that's the thing when you've got a lot of trauma, and it's not just that your thoughts are wandering, but that it's, you could get flashbacks.
You're getting slammed.
You're getting.
I mean, I talked to a big meditation person, also teaches, and he was like, oh no, anybody can use meditation. And I'm like, no. Not if somebody has a really complicated trauma history. It's one thing to have something come up, notice it and let it go. But if you're talking the kind of traumas that people go through that are really bad, it's too much.
Yeah, and in your book, I mean, you work with people where it's really bad. You have your Virgo planets there in the eighth house. And is it okay? I relate. This is how I speak, right? It's not
Yeah,
shift.
it's great because I know nothing about this.
Yeah, it's just reflected in the stars. That's all I'm saying. It's reflected that you are a sort of person who can go very deep, and that you would also have a tendency to being on the edge somehow, walking now, working on people who are, on the edge. Like it's really difficult. It's like the worst examples. I mean, it's scary
It's the
stuff.
worst examples. It's bad examples, but I think the deal is that what I think is if this person who's sitting across from me has gone through this, the least I can do is sit with them.
Yeah,
And that helps me stay centered or stay in self.
yeah,
And I also know that it has a huge success rate, or there's a lot of healing that's possible for most people. I mean, there are always going to be some people who are too damaged or can't for whatever reason, but there's a high percentage of people that heal or get much better in treatment.
mm,
So
yeah. Yeah, to sit with them, and then you have all of these things that you can do. And you mentioned the hypnosis there. I was very intrigued by that because in a way it's kind of obvious in IFS language, and even in other kinds of therapy, that it is a bit hypnotic. IFS is even more, I think, because you close your eyes. But
yeah, except IFS would say, no, 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 there's no hypnosis in IFS.
okay, they would say it's not.
I would disagree with that.
Would you?
However,
Wouldn't it
oh
be
yes,
like wouldn't it be hypnotic at least? Like,
no, 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 no.
okay. Okay.
But I agree. I mean, trance is sort of the inform what we do. People go into trance in and out often. People who have
Yeah,
big trauma histories, I'd say, go in and out more often.
of true.
And
Mm.
yeah, and work with people. So, I mean, I don't do a lot of formal hypnosis with people, but I like to help them use the trances they're already in,
Yeah,
and facilitate because, IFS is, it starts out by saying focus inside, and putting someone in a trance is just helping them focus.
yeah.
And when you're focused, you're not distracted. So you're
Mm.
learning more. And the other thing is that what focuses people is being abused. So if someone's being raped, they're in a trance. And so they're really focused, or they're completely unfocused. They're dissociating, which is a trance state also. So, you know, one thing I learned early on is that if somebody is abused, they're in that kind of state. It's like state dependent learning. They're in a trance state. So if you want to help them unravel it and heal, you need to get them to a state that's similar to that. So
Oh,
hypnosis gets people close to where that material is, and then helps facilitate the healing. So, but for a lot of people, you can use hypnotic language.
yeah,
Um,
yeah. So
and so
you're really sharing about that in your book, and yeah, I just wanna
I think
reflect on.
it's really important because using some hypnotic language just makes therapy work so much better.
Yeah, yeah. I mean, it totally connects for me to IFS, because I do feel I go deeper within myself. So whether you call
Yes.
that a hypnosis or not. But yeah, it's really interesting what you were saying, the state dependent. So the state you were in during the trauma and the state you're in during the healing,
Right.
that's beneficial to that's on the same plane.
Hmm.
Interesting.
Yeah.
It
And I mean, it just makes sense.
yeah.
And I'm not sure what the what the fear is about acknowledging when there's some trance going on, but I know there is. EMDR also says there's no hypnosis in EMDR, although they use safe space imagery.
Right.
They teach it, although I think not. They don't teach it in a way so it's so good for people with complex trauma disorders. Better to read my stuff on that.
Yeah. Yeah.
And containers, I mean, it helps to use some hypnotic language.
Yeah.
I'll give you an example.
Mm.
So if you say to somebody, try and figure out a safe space, or try and figure out a space or a place that you'd like to feel safe in. If you've grown up with somebody who's been really, really critical and you feel hopeless and helpless, you're going to the normal response is, I can't.
Exactly. Yeah.
Way better to say, what's a place or a space that you felt safe in or you'd like to feel safe in? I mean, in a way, you just take out that option of saying, I can't. And
Yeah.
for most people, that's like super helpful.
It really is. I mean, comes back to like the first therapist training I did where we had to imagine just like picture a wonderful place. Just say something you really love. It was quite simple, and I just couldn't do it. And I realized, oh, there's a huge blockage here around being happy, something like that. So yeah.
Well, in difficult childhoods, and Dick said this once, and I think he said it really well. He said, in difficult childhoods, parents don't want their kids to be in self. They punish kids when they're in self.
Yeah.
And, he just said it in a way, I've heard it other places too, but I thought that was a really nice way of putting it.
Yeah, it
And
is.
I think it's very true. I mean, parents who are dysfunctional, they don't want a kid who's in some ways happy. They want a kid who's compliant. They don't want to know the kid is a whole person. They don't want the kid to feel good about themselves. It just doesn't work for them.
They don't have
So,
the resource.
or love or hope becomes something that's dangerous. And safety becomes dangerous because sometimes if you're promised safety and then it's not really safe, it becomes a scam. And then, that doesn't feel good. I've had people, when I've said, what's a place or a space you felt safe in, they say, I've never felt safe in my life.
Yeah.
And that's why I started adding in, or a place you'd like to feel safe in.
So it's incredibly helpful. It really is to
Yeah.
like
Well,
that.
your example's a good one.
Yeah.
What's something you love? Well, what if you got punished for loving anything? Or if you loved something, it was always taken away from you. You're
Yeah.
going to grow up a person who just says, no, I'm not doing the love thing. That's dangerous.
And also the thing you just said around it being a scam. Do you say
Yeah.
I recognize that? Yeah, like I can't trust it, or if it's good, then it's not real. Something.
Right. Or the whole thing that a lot of therapists learn, and I think I did too, was you have to have clients have to trust you before they can start working on
Yeah.
things.
Yeah.
And I'm like, hey, if I grew up in your family, I wouldn't trust anybody anyway. Don't
Mm.
worry. You don't need to trust me. Trust takes a long time. I'm not sitting around waiting for trust to develop. We'd lose all this time.
Mhm.
And it doesn't make sense when people have been, comprehensively abused and lied to and, not grown up where there was any kind of trust.
So you're saying here that in regular IFS, you wouldn't consider the trust very important. It's a factor, but not very important. And what you're saying is that it fundamental when you're working
What
with.
I say is, I acknowledge that people aren't going to, if somebody's coming in, I might acknowledge that they don't need to trust me. Because people have also heard they need to trust the therapist, and that puts a lot of pressure on them
Okay, like
if
that.
they never grew up being able to trust anybody.
Okay.
Or somebody says, trust me, we're going to have fun, and then
Yeah.
abuses you.
Yeah.
Trust is going to be a hot potato.
Mhm. Okay, so you're actually taking the pressure off. You don't need to trust me, but then in the
Right.
back of your
Makes sense you don't trust me. And, you know, if you're worried about something or if I say something you don't like, let me know.
mind.
If I get something wrong, let me know.
Yeah.
And I'm putting that out there because I know I'm not going to get everything right. I know I'm not going to understand where they're coming from. And I want to create an environment where they can start to grow and not one where I'm scaring the crap out of them by saying, we're going to work on trust. I think I'm just thinking of Dick's thing about being a hope merchant. And with these clients, you do not want to be a hope merchant because it's promising too much. So it can be very scary.
It's
I've
promising to,
worked with,
yeah.
right. It's like, oh, you're going to heal.
Mm.
Yeah. If you've been lied to your whole life, you're not going to necessarily believe that. And that's going to set up a dynamic where there's a problem in the relationship right away.
Oh, I recognize
So
that. Yeah. Yeah.
I'm going to be much more even with affects because, I'm not going to be like, oh, that's so hard, or you're really great. You're so brave, because excess is dangerous.
How would you be then?
I think what you did, it was really important there.
Mm.
And I know it kind of backfired because you got punished later, but you did something that was right on.
Mm. Mm. Yeah. Okay.
Maybe I'm just going to be kind of straightforward and, yeah, even.
Mm.
I'm going to acknowledge it, but I'm not going to be excessive.
Right. All right. Oh, that's really good. Okay. So being excessive is triggering when you have PTSD.
Yeah,
Okay.
especially if it's complex PTSD. Maybe it's okay for some people, and being a hope merchant certainly works for a lot of people, but you have to watch. You have to watch who it's not helpful for.
Sure.
So if I say something really positive and my client starts to turn green or
Mm.
backs up, I'm going to be like, what just happened? Was I too positive? Did it feel like I was trying to promise something that isn't something you trust?
Mm. Yeah, that's really helpful. Yeah. Yeah, I can really relate to that. Yeah. Okay. I I'm moving on. I'm getting lost in.
Yeah, move on.
Okay. Now there's a part of me who's like, okay, remember you're an interviewer. Okay, yes, I am.
And I'm sitting here going, remember, she's interviewing. Let her ask questions.
No, but I told you before we pressed record that I wanted you to just go all out. So no worries there. Just a question that I just remembered from something you said. You mentioned parts who have no body, and I was
Oh, you
curious
mean
around.
like, yeah,
I was just curious around that phenomena. I mean, in a way, yeah, yeah.
I
How do
think,
you think
I
of that?
think, basically the people I work with who have the bigger abuse histories, and, the research is that you don't need to have abuse to end up with a dissociative disorder or borderline personality disorder, which is a trauma disorder.
Mm.
Um, or complex PTSD. What you need is um, abandonment, neglect, and attachment problems around when you're 2 or younger. And the research was that they followed kids who were 2 and younger with those parameters. And then when they were 18 to 19, most of them, a very high percentage, were diagnosed then with BPD or a dissociative disorder.
Mm.
So not necessarily trauma, although in those families, they're the parents who don't notice when the kid's being abused by the neighbor, or, I think of it as traumatic neglect. I think there's a lot of trauma around neglect and attachment problems. The thing is they're kind of invisible. So a lot of times when I've finished working with somebody on the glaring trauma issues, then we work on why didn't they love me? Neglect, attachment stuff. Of course, it's woven through the whole treatment, but I just wanted to say that because some people think it's all trauma, 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 and it's not. It can be other things.
Yeah, so but then it becomes an issue of how you define trauma, right? But because from what you said here, it can be attachment issues. So
yeah, so I mean the borderline personality disorder, that diagnosis was developed by someone locally. I never can remember who, but apparently the sample size was 7 or 8 women with big abuse histories, but he didn't think it was relevant. So,
okay.
yeah, right. So they were extraordinarily difficult to treat because, of course, they weren't getting coping skills. They weren't doing trauma work in the way that, we do, or the we who knows how to do trauma work does trauma work these days. And so they weren't getting better.
Right.
So they got a bad name. And
so I feel like asking you about drug abuse now, but did you want to answer the thing about a part not having a body?
oh yeah, part not having a body. Thank you. Yeah, the whole deal is with parts is how do you get through a childhood that looks impossible? I mean, I sometimes think about how horrifying, like somebody being raped is horrifying. How difficult it was to get through when I was assaulted in college, and I was not raped, but it was bad enough. And, I'm often working with people who, have basically been raped their whole childhood. So how do you cope with that? How do you get through your childhood? I think, there's the population that probably kills themselves. There's a population that probably ends up being, hopelessly alcoholic and drug addicted, non-functional. And there's the population who end up managing to get them, managing to be together enough to get into therapy where hopefully they can heal. But how do you manage that? Well, if you're being beaten constantly, it's just efficient to have a part has no body, because then that part is a part that's not being hurt. And maybe that part comes out during the beating and takes the beating for the system. Or a part who's completely numbed out takes the beating. We have amazing capacities, and hypnosis also helps people develop capacities. There was a woman visiting our house once who her back went out. She had huge back problems, and she had to go back to the West Coast the next day. And I said, well, I just learned how to do glove anesthesia. How about if I practice it on you? And glove anesthesia is a hypnotic process of making your hand numb. And then you transfer the numbness to the part of the body that's needed. And then you leave a signal pain because, you don't want to be doing cartwheels or anything crazy with a back injury. She needed to get back to her back person. And so I taught her that. And that was the one pain-free day she had. Now, people automatically sometimes learn to numb their bodies out when they're being subjected to a lot of violence. So no body, numbed out body, that can be helpful. Or, I met a part once who said, beat me, rape me, I like it. And she was a protective part who came out when she was going to be raped. if you're going to be raped every night, kind of helpful to have a part who thinks it's her job and she likes it. And
Yeah.
she lubricates and gets it over faster with
Mm.
less damage. We're not talking about a situation where there's a good option.
No.
We're talking about a series of kind of desperate options and survival.
Yeah.
So,
Mm.
the part with no body, how is it helpful to have no body? I don't get hurt.
Right. Yeah. Okay. I really recognize that. Yeah. Then I don't get hurt. And then
Yeah.
we have to work on how to, well,
Well, we have to work on what IFS calls, what does IFS call it? Walking on the word. I call it orienting to the present. Parts are in the past
mhm.
and they need to come into the present, because when they're living in the past, they may still think they're being abused every day. And it's like a whoosh of anxiety that person is experiencing every day, because a part still is locked into that past mode. So getting them, retrieving, that's the IFS word. So retrieving them to the present then helps. So this is a present where they don't need to be invisible or have no body because they're not being hurt all the time. Now it's not quite that easy, because as long as whatever the trauma is hasn't been dealt with, they're going to slide back there. But it's still easier once they've become aware of the present. It's easier to work with.
I do want to ask you about the drug abuse. And I mean, it's like anything that's really horrible, you have experience with that, right? So I wonder, probably drug abuse as well. Yeah.
I'm
It's
not a real addiction person,
okay.
but I have worked with people who had some serious drug problems and alcoholism, because of course, if you're being hurt a lot and you're depressed and anxious all the time, having a few drinks or taking some kind of drug is going to make you, temporarily feel better.
Yeah. So could we say that your area is anything self-destructive?
I work with a lot of self-destructive stuff.
Mm.
I was thinking about a woman I worked with who she we had finished working on pretty much everything and she was feeling so much better. And she said, but the weird thing is I cut about once a month. And so we identified the part that cut, and she had enough self energy. So I said, just ask the part, how is it helpful to cut? And the part said, well, she's going to get abused again. So I just want to keep her ability to numb her body out going. So I cut her once a month so she continues to be able to numb her body out.
Mm.
And I said, well, let her know she can keep that ability without cutting, but ask her where she's living. Sounds like she's living in the past. And we got her oriented to the present, and the part said, you mean I don't have to cut anymore? We're like, nope, nobody's allowed to hurt you.
Mm.
And she's like, great. It was easy. That was easy. Sometimes it's not that easy, but it's a really clear example. That part was helping her by maintaining her ability to stay numb. Now, that example of glove anesthesia was me teaching someone to numb out parts of their body. If I'm working with somebody who has a part who can numb themselves out, or the person's numbed out, I tend to install that with a little EMDR. The resource work with EMDR is you kind of tap the resource in with a few slow taps. They talk about 8, but sometimes I do less. I'm like, hold on to your ability to numb and just tap that information in, because numbing's a great resource. I always think if my house is burning down and I fall down the stairs and break my leg, I want to be so numb so I can crawl out, right?
Yeah. Okay. In that situation. Yeah. Okay.
Yeah. So I want to be able to use it for when in an appropriate situation. not be automatically numbing because some of me is living in the past and thinks I'm going to get beaten every day.
Absolutely. What do you see as common denominators for, well, self-destruction, or because you also have a lot around suicidal parts in your book? Is there anything
Yeah.
links those?
What I want people to do, and so mostly I'm working with people with really complicated trauma histories. I'm working in with direct access. I am not talking about people getting into self, because often there's nothing there and they just get depressed and they're trying to do this self thing. I worked with somebody, just finished with her last year, she was in IFS therapy, and the therapist tried to get her into self for 8 years. And she was like totally depressed because, there wasn't anything there.
Okay.
And okay, sometimes you can do it, but sometimes when there's a lot of trauma, there's just no self there. I mean, I know it's deeply there, it's there on some deep level, but what I do is I sit in self energy. And if you're in self, it pulls for self. And what I'm energetically feeling is that I'm connecting with the self of every part, and that parts can all develop self energy. And eventually it starts stringing together. So I might have a part, and I'll say, okay, so, I mean, there's a lot of connecting parts with each other, which I think is different than IFS, because IFS is mostly self to part. But I think with people where it's complicated, it's much more efficient to have the parts working with each other in between sessions, else you can take forever. And, mostly I want people to feel better. I want them to not be living with so much pain. So I want things to be efficient. So I might say to an older part, what do you think about this younger part? And they may say, I hate this part's guts. And I'm like, I think I wrote this in my book. I said, well, tell that part you hate the part's guts, but you know the part's there. And you also know that you're working with me. So someday you have to get to know that part.
Yeah.
And I'll say to the part, you let me know if it feels like it's taking too long. And that's a bit of self energy, recognizing that a part's there. It's not just the C's. I think, in abusive families or difficult families, they don't recognize, they treat the kid not like a whole person. They want the compliant parts, or the parts they can dominate and control. They don't want the curious parts, the interested parts, the intelligent parts, the parts with needs. So I'm like, it makes sense that you don't want to get to know yourself as a whole person, because that's what you learned growing up. We need to do better than that.
Yeah, yeah, for sure. Um, when you said we need to do better than that, what were you referring to there?
We need to do better than their parents.
Yeah,
Their parents who said, you have no needs, or you're not allowed to have needs. You're not allowed to say no. You're not allowed to have feelings. You can only have the feelings that I allow you to have.
yeah. So let's do better than that. Yeah. Um, yeah, I remember reading that in your book, that you were talking about a a younger part can help a baby part.
Mhm.
So is that
Yeah,
also
sure.
one of the main differences from what you do and more another kind of IFS? Is that one of the differences?
Well, what I would say is it's just standard with working with people with parts.
Yeah.
And IFS doesn't have that knowledge base.
Okay.
Um, so, which is too bad, because, um, yeah, just because a part is 10 doesn't mean they're not like a 10-year-old child. A 10-year-old part may have been a parentified part, may have lots of information. And the other thing is parts learn. So that part may learn how to do some caretaking. Or I can't remember what's in my book and what isn't, but I worked with somebody and she had a very high-powered job and she had been on disability and in hospitals. And then when we were working together, she got another high-powered job. And so we developed a work team. So it was like 4 older parts who knew how to do this really high-tech job.
Okay.
A couple weeks later, she came, and the negotiation was all the other parts would stay at home or stay in safe spaces, and these parts would handle work. And she came in and she said, there's a problem because everybody at work says I'm stuck up because I don't go on breaks and I don't socialize. And so I said, well, ask inside who can help with socializing. And a 5-year-old piped up and said, oh, I can. I like to socialize. And she said, that kid used to go visit the neighbors, that part. So the kid joined the work team. And then with her energy, she didn't come out, but with her energy, they were able to socialize.
She didn't come out.
She didn't come out. It's not like, you don't want a 5-year-old coming out at work talking like a 5-year-old. You want the energy to somehow be with the adults, so the adults are using her energy to be able to socialize.
It becomes a whole personality technology.
Yeah. I mean, they have the personality technology anyway.
Yeah.
So we're just working on it becoming higher tech.
Yeah.
I didn't have a smartphone when I was a kid. I used a dial phone, then a push button phone, and now I use a smartphone. When you're a kid, you have all or nothing defenses. You shove everything under a lid, and nothing's there. So we'll evolve the lid so that you have more choices and more control. You can take out a little bit of information, put it back in. That's sort of a container way of using a container.
I think that's
So if
really,
somebody has a really complicated trauma burden that they have to work on, you don't want to take it all out at once because it could be overwhelming. But maybe you take out 5% of it, work on that. Then you take another 5% out.
yeah. Yeah, no, I think it's what's brilliant about it. There's several things, of course, that's brilliant about your book, but that's one of them that we can work consciously on, yeah, dissociate better, use those different parts of us and emotions.
And it's super helpful. I mean, I've had people say, wow, life is so much easier with some coping skills. And, there's a lot more possibility for problem solving. I've had people where child parts have popped out at work and not known how to handle things, or popped out in the middle of a doctor's appointment and been really scared. Much more helpful to have things organized in advance.
Yeah. So efficiency and being organized, it's so Virgo, but there's no escape from that.
I mean, it's, this is all the technology in the dissociative disorder complex trauma field. This is not all my stuff.
Yes,
I mean,
yes.
there's some things I do a little differently than others, and I think we all put our own stamp on whatever therapy we're doing. But this working with dissociative disorders, people have been healing for years without IFS therapy. I mean, I teach IFS therapy because I think it's elegant and I think it's super helpful and I use it with all my clients. But some of this stuff, like taking a container and putting god awful trauma in it, taking 5% out or a few drops out, that is technology that's been around for a long time.
Okay. It is in what you call titrating. Yeah. So, but what if you can't do that? What if you have a client who's like, I can't do that? Is that when you then suggest some more hypnotic language?
Well, there's always people who can't do it, or they've been in therapy, not been given coping skills, and they've had a therapist who got too much out too fast. And then that starts eroding their dissociative defenses. I'm supporting how they're dissociating. But if somebody says, oh, we're going to unburden this, we're going to witness this, and it's just too big a piece, then a person can decompensate. And I've treated a lot of people who've been in therapy that's not been so helpful. And I'm not just talking about IFS. And it's what I learned when I was in school. They said somebody has a sex abuse history. She needs to feel her feelings, help her feel her rage, help her feel her terror. Basically, it was fast tracking people to the hospital.
Oh,
The wisdom now is using phase-oriented treatment, which is something that IFS teaches is bad, but I think they have some misconception about what it is. The 3 phases of trauma treatment are: the first phase is developing safety, symptom management, parts getting to know each other. Sometimes not all of them, because if somebody has a huge system, it's just not practical. So the ones who are on the surface, but it's managing coping skills, daily life, getting stabilized. And then the second phase is some kind of version of paced uncovering of traumatic material, which I would call maybe fractionated witnessing and unburdening, not trying to do too much all at once, trying to make it manageable, chopping it down to size. And then the third phase is kind of whatever else people need. Coping with life, a life that's not based on trauma anymore. New relationship skills, whatever people need.
like that.
Consolidating gains.
Okay, yeah. So the first phase is basically, I mean, when I feel I'm disturbed, have a multiple personality disorder, that's when I haven't slept. That's when I haven't eaten well, taken care of myself, because then the psyche is just even more, yeah, all over. So,
well, that would be phase 1 would be, sleep problems are, a lot of people with trauma histories have sleep problems. It's not so easy to deal with, but dealing with what can be dealt with, like, okay, maybe we need to talk about you eating regularly, maybe putting an alarm on your phone so you remember to eat, maybe being on medication. I mean, I just don't think the M word is a dirty word. There are people I've treated who, if they hadn't been on medication, they would not be done with therapy.
yeah.
So, I think medication has side effects, but not being on medication can have horrible side effects. So, what's going to help with healing here?
Yeah.
I'm not going to be against medication. So,
It's
it's figuring out.
finding the fundamentals so that you can build on that. Yeah.
And you might, people who grow up in dysfunctional families, I mean, they're not taught to take care of themselves. So it could be basic, like, do you brush your teeth every day? Do you go to the doctors on a regular basis? Do you wear a coat when you go outside on a freezing cold day? I mean, I've worked with people who've had a hard time with all of that. Or a client asked me one day, she said, what's it feel like in your body when you get your period? This was a while ago when I still did. And she said, when I get my period, I have horrible flashbacks. What does it feel like in your body? Because she'd have flashbacks because there'd be blood, and she had been raped violently a bunch of times. So it would get mixed up in her mind. So we had to sort things out, like, what's that feel like? What's reasonable to expect? Pain can be a big trigger.
Yeah.
So cramping was a huge trigger for her.
Mm.
Running on a treadmill was a trigger because she'd start breathing faster. Breathing faster was something she did when she was being beat because, terror.
So really those parts living in the past, thinking it's the same now and getting anxious.
It's the same now, right? And how do you help them differentiate that it's not the same? So that's all phase one stuff is helping people figure out how to manage their lives in a way that's different
And
and
it,
how to upgrade their coping skills, their natural ones, so that they work better. And I know IFS sometimes teaches that managers get pissed off when you give them coping skills because they've been coping. I
oh,
have never met a manager that didn't like to have higher tech management ability. I mean, it's kind of like, having an old, rusty printer and then getting a new one that staples things too. Which one do you pick? You stay with the old one or do you get the new one that staples things and collates and does all this stuff? I'm taking the new one and doesn't take forever.
a new updated.
New updated. Yeah,
Sounds good. Yeah. Okay. So I see. So maybe so that is actually one of the major differences that you're suggesting here is to include face-oriented therapy rather than thinking it's a self-regulating system and
right.
everything's gonna be well once you're in self.
Get into self and everything flows.
Yeah.
I think that's too simplistic. Um, I think people need coping skills. And I think even people who have anxiety disorders and, you know, easier PTSD, not that I don't mean easy, but where there's not as much trauma, they can do regular IFS. But I teach everybody safe space imagery because, if you have any kind of trauma history, your body your biological reactivity level is higher than normal because you've been living with anxiety and depression and stress, and your body's gotten used to it.
Yeah.
So what I teach them how to do safe space imagery, and when they do it every day, it decreases their reactivity level, and they feel calmer overall. It's easier to work on trauma when you feel calmer overall.
It's justice. It just is. Absolutely. Yeah, and even you could go into neuroception and like just how you perceive the world is gonna be so different. Actually, I do feel like asking you because we're just coming to wrap up this conversation, and actually, if I'm a little cheeky here, I feel like asking you if you could maybe guide one of those here in the end. How would that feel?
Right now, like a
Yes.
little safe space imagery, sure. But let me say one thing is that um, if I'm doing it with somebody with with dissociative parts, I'm going to ask for a part to do it with me.
Ah,
Um, and maybe you can just do it with me.
yeah.
Um,
So
and
so what?
because doing it because if I'm doing it with somebody I don't know, they may well not trust me. So I want a part to volunteer to do it for 5 minutes so all the other parts can watch and make sure I'm not pulling a fast one.
I
And while they're watching, does that make sense to you?
I really love that. I love that because I that's my struggle constantly is like, oh, there's now 10% over here who don't believe anything you're saying, right? So
Right.
if I just can choose one part who's like, or a group of parts who's in on this, I think I can
So
do
is there a part or a group of parts who'd be willing to do this with me for a
this.
few minutes? Great. And just check inside. Is there anyone with a concern or questions that we need to deal with first?
I think they're in the background just saying it's probably not going to work. They're just in the background.
Yeah, I appreciate that they are willing to let us try.
Yeah.
So I'm just going to talk directly. So is it a group of parts or one part?
There's a
Okay,
group of parts willing, at least. What?
okay, so ask them, would they like to pick a spokespart to talk directly with me, or do they want me to go through the adult?
Through the adult.
Okay, so what are you feeling towards this group of parts?
The ones who are willing or the ones who
The
don't?
ones who are willing.
Okay, what I feel, I really, I like them. It's all of my excitement.
Okay,
Yeah.
and let me say, if you said, oh, I don't think it's going to work either, I would negotiate with you and say, can you drum up just a little bit of curiosity
I,
or willingness to try this out?
I
Um,
see. Yeah.
but yeah, that's great. So just let them know that you're glad they're willing to try this out.
Yeah.
Okay, so just ask them what's a place or a space that they'd like, that they've felt safe in, not from their childhood, or a place or a space that they'd like to feel safe in.
And maybe we'll do this without that I'm saying it, just so the listeners can put in their own words, right?
Okay.
So I'll
Yep.
just answer it inside myself. Can it be like that?
Just let, yep, it can be like that. And I'm going to say that if they don't visualize, it could be a place or a space surrounded by music. It could be a space that is something like in total blackness with a feeling of soft blankets. So it doesn't need to always be visual, but just ask those parts. Do they have a place or a space that they'd like to feel safe in?
Yeah.
Great. Okay, so just ask them to look around this space or place with all their senses and to notice everything that makes it safe to be there. Maybe they're noticing some things or a feeling like sunshine or a smell or a sound, just anything. Okay, they notice some things. Yeah, so just ask them to keep looking around with all their senses and they'll notice more and more about it that makes it feel safe to be there. How are they doing?
They're good. Really
Okay.
nature, feeling safe.
So this time I'd like them to just keep looking around and notice if there's anything that doesn't feel quite right. Just maybe there's something, maybe not. Maybe everything feels okay, but if there's something that feels a little off, um, do they notice anything like that?
Yeah, that could be, but they don't want to look into that.
Okay, well, it's okay. Just have them keep looking around with all their senses and they'll notice something that helps with that. They may see something or hear something or feel something, or a thought may occur to them that just helps with that. So what are they noticing?
Yeah, noticing that I can erase it.
That's right. And just let them know they're doing great. You know, we're just doing this and they're already getting rid of things that don't feel quite right. So ask them to keep looking around, and if there's anything else that doesn't feel quite right, they'll just notice that something comes up that they can do to help with it. They'll see something or hear something or notice something. So how are they doing?
I feel like they are pretty safe here.
Great.
Yeah.
So just ask them to tune into what they're feeling. And as they tune into their feelings, the feelings will get stronger and stronger. And maybe they can are they okay with saying what they're feeling?
Yeah, feeling refreshed.
Yeah.
Having light inside the heart.
So just as they breathe in this light, the light in their heart and that feeling of being refreshed, they can just feel those feelings settling deep inside them, even on a cellular level. And ask them if they're okay with staying there for just a few moments. So I want to ask the other parts what it's like to have these parts in a safe space.
Mm-hmm.
Is that okay with them?
Yeah. Feels a little scary to go there.
Okay, just for a minute.
Yeah.
Just for a very short period of time. Is
Okay.
that too scary, or is that okay? Because if it's not okay, then we're not doing it.
They don't want to lose this good feeling.
No, I'd like them to stay with the good feeling and just maybe let the adult talk to me for a moment. But I want them to stay in their safe space with the good feeling of feeling refreshed and feeling light in their heart. Is that okay with them?
That's okay.
Okay, so I'd like to ask the adult or other parts who are watching, what's it like having this group of parts in a safe space?
There's no objection.
There's no what?
There's no objection to it.
No objection.
Yeah.
That's great. Anything else? Sometimes people feel like a sense of lightness, or they feel like things are suddenly less complicated, or
Oh, like that. Okay. Yeah, I thought maybe
it's a
I would.
little more peaceful, or
Right. No, I definitely feel that. I definitely feel that. Yeah. I was just looking for someone who's protesting to this, but now I definitely feel more lightness and
okay.
feeling more centered.
Okay. So go back to those parts and just let them know if they want to hang out in their safe space, they can, or they can experiment with coming out and going back in. And they did a really good job. So what would they like to do?
Stay there.
Is that okay?
Yeah.
Okay.
So they stay there and then we would go into therapy. Oh, this is of course.
Well, actually, I think we're gonna finish the podcast.
Yeah. Joanne, sure. I'm not
All
that,
right. So,
but
so
just like generally what we do from this place. That's what.
well, this is teaching a skill. And so I want all the parts to have safe spaces. These parts were willing to do one together. Sometimes they want separate ones. I mean, sometimes teenage parts don't want to be in with little baby parts, or they have different needs or, something. But say that, like in my example, where this woman had this complex job,
Yeah.
and she had some child parts who were holding significant trauma. And they would stay in their safe space while she went to work, and then work went better. So if we were if say there was a part that was holding a burden and we were going to work on that particular burden, maybe there's some parts that weren't part of that burden who don't need to be present. So they can be in a safe space and put soundproofing and feeling proofing up and just not be present while we're working on this burden. I don't want the whole person to get disrupted because we're working on some trauma from the past. So it's just a way of working that's a little more careful and is essential for some people. When you mentioned suicide before, I've worked with a lot of people who've become decompensated, gone from working and being really productive to being like in and out of hospitals, cutting and burning and with suicide attempts. And then the hospital says, you need a new therapist. And they were sending him to me for a while.
Mm.
So, it's just what I would rather is that the parts are protected so we can do a chunk of trauma work without them getting unraveled. And then they're protected from the trauma work, or they're protected from something that's difficult for them. Like maybe they have to go home and see their parents once in a while. Some child parts get really disturbed about that. Well, maybe they can stay in a safe space and not go on that home visit. Older parts who can handle it better can do it.
Wonderful.
Maybe if you're asking a boss for a raise, it'd be better not to have a wildly anxious part who doesn't feel like they deserve anything, not be present.
So there's many ways to use the safe space that we've just been working with.
In addition to that, you can feel the sense of relaxation these parts got into.
Yeah.
And practicing that really helps people feel normalize their body. So they feel more relaxed overall. And then life is easier, or the trauma work is easier. And
Yeah.
it's also about people having control and choices. So
Yeah.
a lot of times people come in and they're anxiety ridden and they have horrible stuff that they need to work on. Okay, it's not so much fun, but they can do safe space imagery. It's like going on vacation, feeling something different, have the trauma in a container, take a break. Nobody can do trauma work all the time.
Yeah, that's really good. That's the good last words. No one can do trauma work all the time.
Hey, I go on vacations.
Except maybe you.
No.
No. It's heavy stuff. It's heavy duty. Oh man, this was really good. I really enjoyed being guided, and just trying that out just made me feel what it was all about. It's different than reading it. It's like, oh yeah, okay, this is, and it can go in many directions. And of course, there's also a part protecting this interview somewhat. So that's in there as well. But I hope people got something out of that and can hear it again and go somewhere else. That's interesting. Yeah. Thank you so
Right.
much,
And
Joanne. I don't know how to
yeah,
stop this interview because it's so good, all of what you're saying. But do you have anything in the end that you'd like to probably say here at the end?
well, I was going to say that usually when I say when I've done some safe space work on it with people is I'll say, and as the parts are in the safe space, they're learning more and more about how today is different.
Ah,
And as different needs come up, the safe space will adjust. So it can grow, it can shift. It's not just, you get a concrete safe space and it stays rigid for the whole treatment. People grow and have different needs and things shift. I guess I would say that I'm hoping that what we've talked about hangs together. Seems like we've gone in a bunch of different places.
It's very well connected. That's what I feel. It's bits and pieces from your book and from your perception of and your experience with trauma-informed IFS, mostly, right? And what it requires and what dissociation is and how we can recognize it and work it within ourselves, and how it's also has certain that there's a spectrum there.
Yeah.
No, there's so many good points, Joanne. I'm really, from the bottom of my glowing heart now, I thank you for sharing this with
Well,
us.
thanks for having me.